Let's check these. Tender when I press down here?
No.
As I go up?
Yes.
There?
Not as much?
Not as much. That's the worst one?
Maybe the lower one too.
Here?
A little bit. That one, yeah.
More so there. Okay, so let's get both of those. It was this elbow? The right elbow?
Yeah, it's right here and then in the elbow too. It's like when I go to pick up things like this or squeeze, it's really, I can feel it right through here and then in the elbow.
Ah. Did you notice any like bruising or swelling after?
No, just really sensitive. And like weakness, even picking up like water bottles and stuff.
Yeah. Up and out right through here. Other side. This side's coming down. One more. On your belly. That looks good here. Let's do this counter nutation. So nice deep breath in and out. Good. 2 more. All the way in and out. Last one. In, out. I feel a spot there.
Yeah, right around there.
Okay. So, nice deep breath in. Let it all out. We're rolling. Little push. Okay, one a little bit lower. Good. And let's lift this up a little bit. And nice big hug. I'm gonna go right in the middle here. Let it all go. And one more, but a little higher. Okay, nothing left. Tender when I press there.
Not really. The left side seems tighter and a bit more achy.
Mm-hmm. So I feel the joint restriction on the right side, but you feel more symptoms on the left. Right there. Good, good, good. Right there. You feel discomfort?
Right, whenever I go to pick anything up like this, I can feel it right here and then in the elbow.
Any discomfort when I press in through there?
No, it feels a little bit more...
More down, back through there?
Yeah.
Okay, so hold your arm out, point your fingers
When
up.
I do that, I can feel it.
Don't let me push down.
Okay.
Do you feel that?
Yeah.
And then go like this. Don't let me pull.
No.
Not so much there. Okay, so all of your wrist and finger extensors originate up through here, so most likely could just be like an overuse or a strain of those tissues from the sledgehammer.
Okay.
So I would just work on gently stretching, and to stretch those, you just keep your arm out straight, bring your wrist down into flexion, and you can rotate in and out to target different parts. So I'd find that tight spot and hold that for maybe 10-15 seconds, repeat a few times. This is something that should just continue to get better over time.
But not like that?
That's going to get more of your wrist and finger flexors in through here.
Okay.
You can do that, it's not going to hurt anything,
Okay.
but it's not going to focus on that issue.
Okay.
So there may also be a sprain. There's a ligament similar to your knee on the outside of the elbow.
Okay.
So when I press in here, it's putting stress on that ligament.
Okay.
I don't feel any laxity, so it's not torn, but just the fact that putting stress on it causes discomfort. There may also be either inflammation on it or some damage to that as well.
Okay.
So one thing you could consider doing is laser at the other office.
Okay.
That'll help to expedite that healing process within the tissues.
Okay. Cool. I'll ask Terry about that.
Okay.
All right.
Cool.
Thank you, doctor.